Hi, I'm so pleased that you've joined us for our Building Community Check-in today. I hope you had a wonderful weekend and that your week is off to a good start. I'm Sharon Knight, President and CEO of Hope Communities, which is a nonprofit that's been supporting some of the most vulnerable in Denver for more than 40 years with housing, educational programs, and support services. We've always been committed to building stronger and more vibrant and more connected communities, which is why we knew when the pandemic started, people would look to us for timely and accurate information about the virus, for where to find resources to help get them through, and perhaps a little inspiration and maybe affirmation that they were not alone. And so we have been bringing in area experts since the pandemic started, sometimes multiple times a week, to provide that accurate and timely information that our residents and clients need. We will be introducing a couple of experts actually from Hope Communities in a couple of minutes. I will have Owens and Lara Frey on the show today. We know that people watch this as we launch the show, but also sometimes quite a few days or weeks later. And so if you hear information today that you think would be helpful to others in the community, please share the link to our Facebook page with them. We will be providing information and keep a storehouse of those videos for many months. We know there is a long shelf life for a lot of this information. If someone needs more immediate attention or consultation or resources, please let them know that they can email us at info@hopecommunities.org, and we will do our best to get them the support that they need. I'd like to share a little bit of news with every show, and some of you may have already heard that Colorado has developed a dial designation system to identify different levels of COVID safety by county across the state. So there's a stay-at-home phase, a safe-at-home phase, and a protection of neighbors phase. The best level is the protection of neighbors phase because it shows that a county has sufficient hospital bed capabilities, sufficient personal protection equipment, stable or declining COVID-19 hospitalizations, sufficient testing capacity, fewer cases, and also the ability to implement case investigation and contact tracing so that we can stop the spread of the virus. Denver is right in the middle of that dial, and so there's a long ways to go before we get back to anything close to normal. We also know that spikes are continuing to be high with younger people, primarily those that are congregating outside in parks or on college campuses or attending classes without proper equipment or procedures. As boring as it might sound, social distancing, wearing masks the appropriate way, and consistently cleaning and sanitizing still remains very important. Good news is that CSU got a $3.1 million grant for coronavirus vaccine research, so let's cross our fingers for that one. I like to share a quote each time we have a show, and today the quote I'm going to share is from Elizabeth Edwards. Resilience is accepting your new reality, even if it's less good than the one you had before. You can fight it. You can do nothing but scream about what you've lost, or you can accept it and try to put together something that's good. It would be futile to try to ignore this virus. We will be resilient as we accept the new parameters that are presented before us. So please hang in there with me and help us to keep this virus at bay and keep our communities safe. And now I'm going to move on to the main part of our show. It's my pleasure to welcome two of our program managers to the show today. Owens is program manager for our Northeast Park Hill site, The Gardens, and Lara Frey is our manager of programs for our East Colfax site, Hidden Brook. Both Amber and Lara oversee programs that are customized to meet the needs of our communities. And for people who don't remember, that means programs for residents that live on our properties as well as the broader community around us. Hope Communities focuses on supporting self-sufficiency and offering the skills, the resources, and programs that individuals need to move towards their goals. That means our staff meet clients where they are and tailor the approach as much as possible to maximize the response and the chances for success. I think the fact that our full team was able to adapt on a regular basis to resident needs really helped us to be nimble during this pandemic period. We've been so successful and made such a huge impact, and of course it's due to the people in this room and some other staff that we have. So Amber and Laura, what are some of the things that you're most proud of that have happened during this pandemic period? Amber, do you want to go first?
Sure. One thing that I'm most proud of kind of has a little bit to do with what Sharon just said, is that we've been able to continue and to maintain, our very high standards as far as taking care of community members as well as residents. But kind of within that, the thing that I'm so proud of is the fact that we have been able to remain creative, and we've also been able to think outside the box. So especially now with the pandemic, some things are coming our way that are a little different from before, and we still have that that maintenance vibe as far as making certain that we're taking care of folks and that we're thinking outside the box with regards to resources and referrals.
So awesome. Thank you, Laura.
I want to first say that I'm thankful to Hope Communities because they hired me right before the pandemic started. So I got thrown into the deep end in a lot of ways in working at a new job, and then all of a sudden work changed. So I'm really thankful for Hidden Brook and the Hope Communities community for being flexible. I think going back to what Amber had said, just the flexibility and the ability that we have to respond quickly to the needs of our residents and to our community members. One thing that I'm most proud of is back in June, we started something called 10 Topics, where we would meet with our residents and our community members out in our community garden, set up tents, invite resource navigation and different community partners, and would meet with residents. And so that's been really successful for us. Since June we've been doing this and checking temperatures, making sure people are wearing masks, but having an opportunity to actually network with community members every week. And that's been really popular for the residents, but also for us as staff who just get an opportunity to network and meet with people.
Yeah, it's an awesome program, and even well before that we were doing direct food service, and now with the 10 topics in the garden we can do the food distribution from there, which makes it a little bit easier than having to go door to door for the 120 families that we were serving. But it's one example of many things, as Amber and Laura both insinuated, that is so creative and innovative with our team. So, for some people who may not understand what your normal programs are, could you just give a real quick summary of what you typically would see as programs and services at the Gardens, Amber?
Sure. So at the Gardens, we actually do a little bit of everything, but it really comes down to three. So first off, we really look at youth programming. So before the pandemic and even now into the pandemic, we provide services for our youth, one of which is our after-school program, EEP, or Educational Enrichment Program. So we offer that for our youth. Then we also do resource navigation, and that is a huge umbrella, and there's a lot of stuff that goes under resource navigation, but that's helping folks with applications. That really comes down to helping people regardless of what the issue is, or at least pointing them in the direction of where it can get taken care of. Thirdly, we really look at employment services or our career programs. So we are helping folks to not only find jobs, but to gain better skills to find an even better job. We're also within the youth programs working with our youth to make certain that they too have employment opportunities, especially during this time.
Great. And at Hiddenbrook?
We do a lot of the similar activities that they do at the gardens. We do a lot of resource navigation. We also work with a lot of community partners. Obviously with COVID, instead of having large classes or activities like that, we've really limited that, but looked at ways to be creative. So we still have our community partners coming in. Maybe they're doing one-on-one activities, maybe they're meeting outside during our tent topics. We've had some youth programming, health and wellness activities keep going out throughout the summer with some of our community partners. So that's been really positive for the families and the kids. I would say, the only other thing that Amber didn't mention, but I know that they do this at the garden, is that we have a computer lab that we let people come in. And that's part of like the job. We've been using that for people who have been applying for jobs or just filling out applications online. So I think that's the only additional thing to add.
Okay. And you alluded to our partnerships. You know, we've been known forever, since our beginning, in terms of building strong relationships with community partners. And it's never been more important than right now. What are some of the key partnerships that you have in your communities that help us to leverage resources for the clients that we serve?
We actually have a lot of key partnerships, but really kind of before the pandemic and even now, two, industries or other partnerships that we've really come to value are our healthcare services, as well as our food distribution. So as with regards to our healthcare services, we at the Gardens have really reached out to a lot of different services. One of which being the Colorado Health Network, which is an industry. They're actually located on Cremeria and, East Colfax. And so we've actually referred a lot of folks there within the past couple of months who were having trouble finding health services with regards to testing. They also do some food distribution there. So we've actually really, really used them here a lot. Secondly, we've used MHCD, the Dahlia campus, which is actually located directly across the street from the Gardens. But there, we've really keyed in on mental health issues. We've had a lot of folks who have come to us and who have been referred to MHCD, both adults and children. With regards to children, though, we've really used it in the sense of that social, emotional tag that's kind of, really, really important now, especially with kids and the whole issue with school. So we've actually used both. We're also still, doing food distribution of, fresh vegetables, fruits, things of that sort. But those are the two that have really stood out within this pandemic time.
And I know that you also did quite a bit with Reciprocity Collective and other career-focused programs too, which have gone in and out during the pandemic period.
Very much so. Especially now, since we've had so many people lose jobs, just, industries that are literally not coming back. So we've used the partnerships, especially with the Reciprocity Collective, to help folks, gain better training and actually move on to other industries.
Yeah, some of those industries that people worked in, which were direct service, and those are just probably never coming back.
Yeah,
at least not as
coming back
fully.
Strongly, right.
Right, yeah, that is really sad, but we've got to help them to be responsive. How about for you, Laura?
Right, at Hiddenbrook we have a number of key partners. Project Worthmore is one of our partners, and they provide adult ESL. Obviously with the pandemic, that's had to change, so they've pivoted to a Zoom online model, and it's actually going well for the teacher. The teacher's been really happy with the number of people. So they're doing that right now, and hopefully they'll be following the DPS policy, so they'll be going back to in-person programming with obviously extra precautions. Another real important community partner for us is Spring Institute, and they provide a lot of our health and wellness activities. They're going to be rolling out their hippie program, which is a home something for families. But what's really exciting about that program is they were able to hire 2 of our Hidden Brook residents.
And it's a healthcare program for youth, for infants.
Yeah, and for families. So it's very exciting that they actually hired 2 of our residents that we recommended because of their language ability and their status in the community. So we're excited about that. And they've been doing health and wellness activities throughout this whole time, and they've just kicked off their next session of Girls on the Run. They're going to be doing a karate class. They have a high-intensity interval training program called HIT that they're doing as well. And they also rent out sports equipment to the community and people in the neighborhood, so they have an opportunity to practice some sports. Right On Learning is another one of our key partners, and they help a lot with tutoring and getting kids connected and families connected just to technology and to the schools. And Denver Public Library. They have been great in coming to our tent topics, providing a mobile library so people can utilize a computer, get signed up for books, and they hand out books and things like that. So that's been great.
And I don't think we want to forget that we've had the census at our
Right,
tent
we've had the
topics.
census. I'm looking at my list here. We've had the census there, the FACTS partnership, when they were providing some small $500 grants. Some of our residents got those as well. And then in terms of food distribution, we've been working with Bloom Church, Food Bank of the Rockies somewhat, and then also the Village Exchange Center has been providing weekly food to some of our residents as well.
And we've been purchasing food because of some emergency COVID grants that we've gotten for food. So we buy fresh fruits and vegetables that we distribute to a lot of different families at both of our sites. So, a lot of the places we know, a lot of our partner agencies have been closed, so we've been seeing a lot more community people, even beyond what we normally do. And I think sometimes people who are residents or clients of ours don't feel like they get enough communication. And so if someone is keyed into this position or this Facebook show, I wonder if you could share with us some extra resources that people might seek in the community to help them get through this time.
Sure. With regards to Northeast Park Hill, there really are not, there are a lot of agencies, but unfortunately, especially during this time, they are, not necessarily open. So what I've been having a lot of people do is contacting our office, which, is all the information's out there. Contacting our office and just, inquiring about different agencies. Something that we've done at the Gardens is just making certain that we really have our ear to the street and we know what's going on within the community. So, for instance, things have been really different here lately. With regards to resource navigation, the end of March, we had a young lady who called who actually needed help with regards to finding health services. She was working and did have insurance, through her employer, which happened to be Kaiser. There came an instance where she actually ran out of her medication because if you remember at that time, they were using hydroxychloroquine for a lot of things, especially when it came to COVID-19. Well, unfortunately, this young lady has lupus and was using that very medication to, just sustain life. And so, unfortunately, she needed advocacy. She needed to have someone help her contact her health provider and say, hey, what are some of the other things that we can do? So that's a little bit of kind of what we do. We definitely advocate for clients. We make certain that if we don't have the answer, which often we may not, that we can point them in the right direction. So providing this young lady with advocacy through our office, we were actually able to figure out her medication debacle. And so we were able to help her, and even now she calls and thanks us and talks with us periodically. So that helps.
Well, and all of our contact information is on our website. If you go to hopecommunities.org and then about us and our team, every program manager and navigator has contact information there. So if you have any types of questions, you can reach out that way. You can also send an email to info@hopecommunities.org, and we will make sure that the appropriate navigator gets that query. So we'll really try to be there for you. So one of the biggest issues that families are facing right now is what to do with school. Even some of our staff, we know that. So, finding the right technology, learning how to use the technology, just academic support, and I also think some of that mental health after you're in a room all day and all night with your kids. Are there some things that are happening in the education field in terms of academic support that you know of? I know we've done a show already on that, but is there some kind of advice that you would give to clients out there about education right now?
I would say things are changing like every day as we speak, or every moment.
Yes.
I just sent an email this morning to one of our partner schools who wants to do some tutoring after school. So they're looking at how do we arrange that on site at Hidden Brook for some of the kids. So that just started, as of today. They sent out that inquiry.
Yes.
So things are changing quickly. I think it's really important for us, as Amber said, that we advocate for our families and that we're reaching out to family liaisons or schools saying this is what our need is. We have some community partners that we like working with that have been really great about also advocating for families and parents. Right on Learning's been a great one for us. We've really been relying on Spring Institute to kind of help with that health and wellness part. So connecting families to those, but just listening, we've been hearing people say, I can't work. I have to stay home and make sure my kids are staying connected. And so there's been a little bit of stress that way, so that we're hoping to provide some support for parents, whatever best fits their needs. So we're still asking questions on that and trying to figure out what the best way is for that. But right now we're just listening, and then we're also looking at how do we advocate either with family liaisons or schools, or say, hey, we have this space available. Would you be willing to come and provide some sort of service? Like, I think we're being pretty open.
I think we've all said that.
Yes.
Let us have pods.
Yes, let us have.
Please.
Yeah, so we've been really open. And I really want to thank Sharon for just encouraging us to be open. Because I think that's been really, really important for families to not feel disconnected and to feel like they're getting their needs met and heard. I think being just heard is really important. So we've been really open to being flexible with what needs to happen. So things are changing daily. But I think the important thing, if you're a parent, is to be asking questions of your school and your whoever it is and say, hey, we need some support. And I know Sharon has had Jessica from the DPS on here, so she has some good connections and resources. Right on Learning, and like I said, Spring Institute with Health and Wellness has really been supportive. And we at Hidden Brook we have a room. This many people are allowed to be in it, so we would like to utilize that space. Or we have our garden space. Are you willing to come out and do an activity outside with people? And so.
Yeah, and just as a reminder, Jessica from DPS was with us a couple of weeks ago, and that Facebook show is on our Facebook page. So there's lots of detailed information and links that might help parents to connect with appropriate resources, whether that's academic support, childcare, things like that. So check that out if you have some questions. Amber, what else would you add?
I would say at the gardens, we're kind of trying to take a personal approach. So we are actually piloting a program in which we are matching up students with tutors, one-on-one tutors. And so we've really just been trying to make certain that we, have the support that all of our families need. The majority of the residents that live at the gardens are parents and have children, so they're families. And so we've offered them not only, tutoring with some really great tutors that have, volunteered for us, but we've also offered them mentoring. So we are really trying to look at the holistic approach, I guess, to families and making certain that they're okay. And of course, with that all comes a lot of the resource navigation that Lara was discussing. So, not only are we dealing with parents who are really finding themselves in a hard situation, making certain that they can still, gain all of the income that they need to sustain their household, and making sure that their children are, quote unquote, connected and, are doing well. We're, piloting a program to really push and make certain that those kids have that support and those parents as well.
And talking about connected organizationally as well as individually with families, we're trying to figure out the whole network issue. I mean, technology is not equal for every family across this community for sure. And as we alluded to before, not everybody knows how to use the technology. So we are also creating some classes, how to figure out Zoom, how to get to the parent portal, how to upload your curriculum, things like that, so that school can be a little bit more seamless for families than it appears to be right now. We haven't figured all of that out yet, but we are definitely trying to work it out. So, a lot of our families have experienced food insecurity. So we increased our food distribution program significantly during the COVID time. But if a family still has that lack of real stable ability to feed their families, how can they sign up for SNAP, and what are other resources besides the ones that we are offering that they might access? Amber, do you want to go first on this one?
Sure. So what we have been, discussing with community members and residents is, first off, let's look at, applying for SNAP, which it's a little difficult now because, again, a lot of the agencies are not open or able to do that. So what we've done is we've, invited everyone in with regards to making certain that they're able to apply. So we normally take them to the Colorado Peak website, and from there we are able to, help them fill out applications, whether it be for SNAP or Medicaid or some other type of benefit. So that's, one thing that we do. We're also in very close ties with DHS and making certain that not only are those applications getting filled out, but they're getting to, the correct department. And we have a lot of really good contacts that we're working with, really to make the transition for families a little smoother.
And DHS, of course, is the
Denver Human Services. Sorry, I speak in.
And SNAP is the
abbreviations.
Supplemental Nutrition Assistance Program.
Yes, it is.
I know we all talk in acronyms, so just in case you don't know what those are. So,
Right.
and Laura?
I wanted to stress what Amber was saying about using the Peak website. It's really important for people to understand it is free to access that website and set up your own account. So that's really, really important for people to understand. This is a free thing for you to do. If you qualify or if you don't qualify, it is still free for you to access. The other place where we look at helping support our families are local food pantries or food banks in our neighborhood. And Street Fraternity, we know, does one, and Counterpath does one as well. Village Exchange Center will deliver to people, or you can pick up, and then Metro Carrying also. They don't come all the way out to Hidden Brook, but they are a place that does that. If you're a resident of Aurora, you are able to access a free food distribution where they do baby clothes and cat food and for pets at least once a month, or maybe it's every other week, I think. Regularly get those announcements. But that's for people that live in Aurora. So if you live in Aurora, there's some other resources. We're right on that border at Hidden Brook, like we're 1 block away from Aurora. So your little ID has to say Aurora before you can get some of the Aurora food services. But there are food services that are available, and I think a lot of agencies are looking at ways to make it be accessible for people without that barrier. So there are some other drive-up ones as well. So we try to pay attention and post that for people.
And when Laura talks about the small food pantries in the neighborhood around Hannibrook, and I think also any in Northeast Park Hill, oftentimes there will be a 2-hour window on a certain day. So it's not something that's opened all day. It's not something that will provide all food for families. And so you really have to understand what the hours are and the locations are in order to piece together food for a family. And so it's really important to look holistically, not only if a family really needs that nutritional assistance program to sign up for that, and then to try to figure out ways that they could go to each of these different locations if they really need that food at different times of the week. Now, I know that some of the people that you serve have special nutritional needs. We probably all do in terms of medical, but I know in terms of custom and tradition and so forth. Are there certain food banks or places that they could go?
Yeah, I would recommend Street Fraternity. I know that they're conscious of dietary restrictions, as is the Village Exchange Center. And by that we mean people are looking more at fresh food items, not necessarily canned items. Obviously nothing with pork and different meat items. So those have been the two that we've been referring most people to. I think Metro Caring has been more aware of that in terms of how they're working with families as well. So
great.
Yeah,
and we do expect that the schools will have food distribution as well. Soon we've got to orchestrate that. We have had some issues with food items that did not match customs and traditions of some of our families, but I think they're trying to work on that as well. So we are still giving those fresh fruits and vegetables out each week at the properties. How long do you expect that to last?
So we're doing ideally the 2nd and 4th Wednesdays of every month. And that starts at 10 o'clock, and usually the food's gone by 11:30. And we hope to keep doing that through middle of October, unless we receive some additional funding.
I like that.
Well, and I will say the last couple of times that I have been there, because I actually pick up the food and bring it, there are lines waiting outside the gate to pick up the food. So it's really important to people.
Wonderful. And so we are actually doing food distribution at the gardens as well. So every other Wednesday, and actually I think the 2nd and 4th Wednesday of each month, we are doing kind of like a farmer's market. And so we've actually also had wonderful, fresh fruits and vegetables, and, we offer it, and folks come in. It's a great alternative to a lot of the processed food that, I think our kids are kind of used to eating.
Yeah, fresh is always better. So as we mentioned earlier in the show, a lot of people have lost their jobs or their hours are really cut. And so we've had some people who have tried to apply for unemployment, but others who really also want to just get a new job. So what I'd be interested to hear what some of the barriers are that you both have seen, and then how you have started to work with people to either help them get a better job or to at least fill the gap right now temporarily.
Sure. Really at the garden, some of the barriers that we have seen, number one, of course, is childcare. And that kind of goes back to, the homeschooling piece. But we've also seen people not having the skills to move to another industry. For instance, we've had a lot of folks within restaurant and hospitality industries that now are having to kind of go back and either get new training or really try to take those skills that they have and transfer them, or use their transferable skills to get into a different industry. And so what we've been doing is is we have been referring folks to really different places and working with them as well. So for instance, earlier we talked about the Reciprocity Collective. And what we've been doing is we've been referring folks to them. And they have actually been helping with regards to getting them set up with some retraining and really looking at what are some of the different industries that they're able to go into. We personally have been able to kind of sit down and break down what they've done and look at the industry and look to see how we can take those skills and, as I was saying earlier, transfer them to something different. And we've actually had pretty good success with that. And so we're continuing to do that, and we think that especially coming out of this pandemic, there's going to be a greater need for folks to be able to do that, break down what they've done in the past and take those skills and transfer them to a different job, hopefully a higher paying job.
With benefits.
Yes, with benefits.
Laura, anything to you?
Yeah, I would echo what Amber said in terms of the biggest barrier is childcare at this point. You might have had two people in a family who were working before the pandemic, and now there's just one person working. Obviously, that's a big cut in income for families. So childcare is an issue. People had kind of been at their first jobs in a lot of cases. And so being unemployed, this is the first time they're unemployed for any extended period of time. So it's all very new for people. I think there's a little bit of fear of going back to work because they don't want to get sick. Maybe they had friends or family members who got COVID because of their work environment. So there is still a bit of fear among people of, is it safe for me actually to go back to this workplace? Will I be exposed to something? And it's already taken a toll on my family, maybe a family member or a community member. So we've just been working with people on what are you interested in doing? Let's look at maybe making a new resume for you. And working on just having people have a resume. I would say it's been slow for people to get back just because of that childcare issue and people just kind of waiting and seeing, will this industry where I had been working be safe, or do I really need to look at another one? And I think with our community at Hidden Brook, making that transition into a different job field is harder, and there's a lot more fear attached to that.
Mm-hmm. And
Improved skills.
language is a barrier.
And language, yeah. Language,
Right.
obviously. People actually are probably very good with language, but they don't feel confident. And so trying to work at building people's confidence in what they're doing. So like I said, we got two ladies who got jobs to be like kind of case workers for families. So that's really exciting. And I think they didn't think they had the language or the skills to do that. So the fact that we kind of targeted them, say, you should apply for this. We think you would be great. I think helped build some esteem, and maybe that will encourage other people in the community as well.
That's awesome. If people just don't have enough money to pay their bills, their rent or utilities or other things, what are you doing to help people through this time?
Well, what we are doing at the Gardens is I have a list, and what I do is first off I keep that list updated, and if that's something that you are doing, I encourage you to do that because, as Lara was saying, not just with the school stuff, things are changing daily. Mm-hmm. So one minute an agency might have, funds to help folks with rental assistance, and the next week they're done. So I would encourage you to keep up with, if you have a list that you're going through it, check it, because that's pretty much what we do. And so what I like to do is talk with folks and see exactly what the needs are, and then either refer them, or we've had some cases where we are doing some in-house help. And so definitely go through the agency list that we have, which is not an issue. You can always call or text me. Can you text me? They can text me. or either email us, and I will send that to you. But what I first like to do is see where you are as far as, like what's going on with the family, what your needs are, and then point you to like my personal picks, not a big list of just a bunch of stuff. So definitely I would do that and get in contact with us, and we're able to help that way.
Awesome.
Yeah, I would say the same thing, and I would say right now the big thing that we're seeing is rental assistance, people needing support with rental assistance and utility assistance.
And Trua is helping with
And
some of
Trua is
that.
helping with that, so we've been successful on some applications, getting those through. It's a lot of paperwork, but we can support people as they're doing that, just helping them get everything collected and submitted. It has to be submitted online. That's been kind of another issue, is a lot of stuff has to be done remotely through a computer. So a lot of times it's just us sitting with the person and helping them get that application completed and submitted. This is the first time, a lot of people I think are just used to going to an office, standing there and get an application, fill it out and do that, and you can't do that now. So just helping people, oh, you need this support, then let's go to this website and get started on this process. Let's get that email address. No, let's go to this website and try this. So that it can be a bit overwhelming for people, but I think that's the other area, is just helping people navigate those different websites of where they can get started. Even for looking for jobs. Jobs now are, everything has to be submitted online.
And when you say let's get that email, what she's saying is that we have to help people set up their first email address.
First email, yes.
Sometimes, because they just haven't really worked in that way.
Right, or they're not used to it. We just discovered if you have an iPhone, most people have an iCloud email address that automatically just goes to the mail app. So for some people, we've been using an email address they didn't even realize they had, and we've been able to start getting like their Peak account set up or get a job application in or something like that. So yeah.
I just want to throw in there that a lot of times people are unaware of the resources that are around them. I can't tell you how many times, especially in the last few months, people have said to me, "Oh gosh, Amber, I didn't even know that that was available. I've never heard of that." And that's kind of what we do. We find resources and we get them to you. So I would definitely encourage you to reach out to us and, allow us to help you. And you never know, you might run into something that you've never heard of.
Well, during COVID, because there is such a need for navigation, we've actually added staff who speak different languages. So we're now able to offer resource navigation in Arabic, Burmese, Burundi, Dari, English, French, Kinyarwanda, Somali, Spanish, and Swahili. So a lot of different languages.
Wow.
But if someone speaks a special language like that, how do they figure out who they can connect with, Lara?
So if somebody speaks a different language, usually we ask, what language do you speak? And would you like somebody who speaks your language to help you? And what we try to do is we try to schedule appointments on the day that we know that our community resource navigators who speak those languages will be in our office. And that's been actually working really well for people. We have some people who English is not a problem, they're fine, but they're like, oh, my community member has a problem. Can they come talk to this person? Like, yes, we want them to come talk to them, and we want them to get their things sorted out. So the easiest way is let us know what language you speak, and then we'll look at our schedule and when our resource navigator is around, and then we'll try to schedule a time so that you can come in. Usually within that week is what we try to do.
And we've translated a lot of materials into the key languages for the gardens, but principally at Hidden Brook, where they're about 75% of the folks are refugees or recent immigrants.
Yeah.
So, obviously COVID has weighed heavily on everybody. Are there some specific COVID issues or resources that you guys have seen that we should let people know about?
I would say that there are, and actually it's come up here very recently, there are multiple sites that are offering free COVID testing. And we, for instance, have had the MHCD Dahlia campus, and they actually did this last month, but they offered free COVID testing for anyone. There wasn't any special eligibility criteria or anything along those lines. They were just offering free COVID testing. And so we've actually had a couple of different agencies since then offer the same. Something that we can definitely do is if you can get in contact with me, I can send you a list of those that are up to date and current and are doing the testing outside of like the Pepsi Center. So
Which will be closing at the end of September.
it will be.
So it really, I think everybody is hearing clearly that if you have any questions at all, if you have some specific needs, you should reach out to these two or to our other program navigators. And we've thrown a lot of information at you today already. Any last minute recommendations or resources that you'd like to share before we end?
I would just like to encourage people, get your email address if you don't have one. Don't be afraid of these online applications. We're here to help you walk through that whole process and how to apply for things. I think that's one of the biggest things we've realized is, to an extent, maybe gone are the days of I'm going to show up at the office, get my piece of paper, go home and fill it out and bring it back. It's changed, and now you need to have access to a computer. We can provide that access to the computer. We can walk you through on how to set up your passwords and your email accounts. We are not going to remember your passwords. That's just,
You better ask. I know.
I can't remember my own. So we put remembering the passwords on you. But we do want to help people walk through that process and just be not as afraid of technology, because I think that's going to be one of the after effects of COVID is more things will be online and you have to do an additional, your initial screening will be through the computer before you can either get to a phone call or to an in-person meeting. So we're just really trying to encourage people, remember your password, let's get an email.
These are lifelong skills.
Lifelong skills that you could get away with not having. But now I think, especially if you have kids, anything related to school is going to be done remotely. And we were talking about the Peak account, it actually works better and faster to go through your Peak account and update things. So yeah, that's one of the things that I think will be a significant change going forward, and a bit of a learning curve for some of our community members who have just, oh no, my kids do that for me. Nope, you need to get your own email address and you need to get your own password, and you can do it.
Awesome.
I think this is really, really important.
Anything else you'd add?
Sure, I would just like to encourage you to know when it's time to get help. I've had here recently a lot of people who I'm the last, or the Gardens rather, is the last their last stop. They have nowhere else to go. They're not sure what to do, and they've come up to the wall and they're not sure exactly what to do. Know when it's time that you get some help. Don't be embarrassed by it. Don't be prideful. If you need help, come and get help. It makes things a heck of a lot easier and a lot stressful in this time when, right now waking up is stressful. So please feel free to come in.
We know everybody needs help sometimes.
Yes.
So it's not, any of us might need help at some point. So it's hard if you've never asked for help before. I know it's always hard for me to ask for help, but sometimes you just have to do it. And I think you can see that these folks here would be very supportive and very helpful and very respectful.
Right, and if you don't like the word help, just say, I need a consultation.
I like that.
So I like would you like to just have a consultation? Would you like to just talk for 5 minutes and then we can figure it out? If that makes people feel better, maybe we'll just say we're doing consultations to get people moved in the right direction. Right. Sometimes you just need to talk to another person. Other times you do need, I need to get to that resource. So I think a lot of it is just listening for people and helping consult them.
There's nothing that I'll take that back. There are a couple of things that we haven't seen yet, but there's a lot that we have seen that we never thought we have seen. So, give you a quick example. I had a lady who literally came to me, and I'm not even sure how she got my number, but she came to me asking how she could rehouse her sheep. which is different. That's a little different. And so literally I'm working with her now to talk to different people. And this is throughout Colorado, which kind of shows you how far our stretch goes. But that's something that we're doing. That's a little different, and so don't be embarrassed. Come in and we will figure it out. And if we don't have the answer, we'll always make certain that you get to someone or some agency that does.
And once again, hopecommunities.org is our website, and there's lots of resources right there on the website. And also, you can find the contact information for all of our program staff by going to About Us and Our Team. And then we can give you the consultation that you need to be successful moving forward. So thank you so much for both of you joining us today. It's been awesome to have you on the show. As part of every Facebook show, we've been sharing a book review from a member of our community, our staff, or our volunteer force, because we know people are reading a lot more during Safe at Home mode, and we want you to have a great book list from which to choose a wonderful title. We do try to find books that are available at the public library and downloadable if possible so that you don't have to go anywhere at all before you start reading a really great book. The review today is on Ordinary Grace by William Kent Kruger. It's a little bit dated as a book, but it is quite memorable and it's written extremely well. It focuses on life in a small rural town in northern Minnesota in 1961. The author, I think, is really gifted at allowing us to get that sense of small town and also learning about the intricacies of one particular family. The story is told as a retrospective by Frank Drum, who was 13 during an exceptionally tragic and life-changing summer 40 years before he told the story. Please listen to the full review, which will be posted in just a few minutes, and let me know what you think about this book. That's it for our show today. Thanks again for joining us. Remember, as I've said before, if you have any need for help, for resource navigation, or consultation, please email us at info@hopecommunities.org and we will connect you with the appropriate support to get you through this trying time. Bye for now, and please be well.